Because the world needs to know. Let the redeemed of the Lord say so. Because the world needs to know. Let the redeemed of the Lord say so. Because the world needs to know.
Greetings. Welcome to Say So. I'm your host, Letitia R. Stuckey. Say So is where we talk about it, whatever it is, because what you do not know can hurt you. So let's get to the root. On today's topic, we will be discovering and talking about expressive arts therapy. And forgive me if I'm not looking directly into the camera. I'm multitasking with the technology. So basically, expressive arts therapy is something that I learned about and heard of in undergrad at Forsyth Technical Community College while I was pursuing my Associate of Applied Science in Human Services Technology. And I thought it was just a really cool concept. I thought it was very creative. I thought that it encompassed a lot of activities and things that you can do to help you in your individual lives and in your healing process. So the definition of expressive arts therapy is the practice of using imaginary storytelling, dance, music, drama, poetry, movement, horticulture, which is basically planting and gardening and things of that nature, dream work, and visual arts together in an integrated way to foster human growth, development, and healing. So basically, it's a way to, well, several different ways to express yourself. And in those ways, while you're expressing yourself, you're able to work through different traumas and things that you have gone through. And it's found to be therapeutic in nature. And one of the things that I really like about it is because it's such an eclectic collection of different things that you can do. And because some people are not necessarily journalers or writers, some people are not necessarily artistic, painting and sculpting and working with their hands. Not everybody likes gardening. Some people like poetry. Some people like dance and movement. Some people like dramas or plays or documentaries or things that are visual that they can see that kind of helps them on their healing journey. So the information that I will be reading from is going to come from the Expressive Arts Therapy section at Appalachian State University. And it is expressivearts.com at appstate.edu/. And actually, in a previous one of the earlier shows, I said that I would do a episode on expressive arts therapy because, like I said, I thought it was a really cool concept and a unique, out of the box way to promote healing for yourself or whomever you may be working with, or children. It can be used with children as well, as opposed to traditional therapy or talk therapy or even play therapy. So it can be coupled with a lot of different things. And as I was researching for this podcast, I actually considered going back to school for maybe just to get a certificate or something, to take a few classes in expressive arts therapy because of its healing potential and component. I think that it is really helpful. I think that it is one of the more non-traditional ways of helping hurting people, which you guys know I have a passion for helping hurting people because I know both how it feels to need help and I know how it feels to hurt. So basically, we're going to explore further in expressive arts therapy, and that's still just the definition. And I'm looking for the breakdown of like play therapy, drama therapy, movement, and things of that nature, and how those things can be therapeutic. I know that years ago, once again, in undergrad, and I was in undergrad in early 2000s, and I graduated, I believe, in 2004 with my associate degree. And it only took me approximately a year because I had maybe a year or more credits from Bennett College in Greensboro. So I was able to obtain my degree in 2004 and introduced to in one of my intro to counseling classes is where I believe expressive arts therapy came into play. So the process of expressive arts therapy is the use of expression. Arts multiplies the avenues of which a person in therapy may seek meaning. They're going to seek clarity and healing, all rolled up into one. It deepens and transcends, like I said, traditional talk therapy by acknowledging that each person's process is unique, which is so true. We're all individuals and we have individual ways of healing, individual ways of even learning. So, because we're so individual, why would we all have a standard or custom way of healing? So, while one individual may like talk therapy, another person may prefer to use journaling. I'm a journaler. Movement, I'm a part of a dance ministry and I am growing in the area of movement. Art, I went through a drawing phase in middle school, and it was a very short phase. But when it comes to being creative and using markers and stickers and stencils, and I do still love to create. So I do have some artistic ability, but to draw from start to finish, that's not necessarily my lane. And also it says, or a combination of different experiences during therapy. So this is the process of expressive arts therapy. The accessibility of expressive arts therapy is due to the focus on being not on artistic creativity, but those are not the outcomes or the focus. It's focused on the process of creating. So while you're creating or painting, you may be better able to explain what your painting means. You may be able to elaborate on what colors you're using or why. Different colors symbolize different things. So if a person is painting and they use a lot of blacks or something of that nature, then there may be some darkness or some gray area in their lives or in their thinking or just in whatever they're processing that's coming up and out of them through their painting at the time. If it's red, red is a passionate color. It could be for love. It could be anger. It could be just symbolic of a strong emotion of some sort. It also says a person who utilizes expressive arts therapy, they're not required to have any artistic ability. So you don't have to be an artist, you don't have to be a sculptor, just create whatever is in your mind or whatever is on your heart to create at that time. And a lot of times with expressive arts therapy or play therapy or other of non-traditional forms of therapy, it's just easier because it takes the focus off of you. Like if you're in counseling or therapy, you're sitting usually having eye contact or not with your counselor or your mentor or whomever is helping you who is helping you on your healing journey. And sometimes it can be intimidating. Like you're looking at them, they're looking at you, they're expecting an answer or you're expecting them to answer your question. So it can feel sometimes forced. It can feel sometimes like you may or may not want to share that day. So if you don't and you have the option of creating something, you may be able to incorporate that into your healing process as to what's on your mind and what's in your heart. Can you explain to me why you use this color, or explain to me why the parents are over here and the children are over there, or different placement or reasons, like I said, for why. Why did you opt to do a painting or a drawing of the family or write a poem about the family? So things of that nature. It really takes the focus and sometimes the pressure and stress off of the individual that's coming in for services, as well as the mentor or the counselor or the person that's facilitating or leading the service is being offered. It's a more laid back approach, definitely. A person who is utilizing expressive arts therapy, it says they're not required to be artistic. Rather, it is through the use of the individual senses that the imagination process can happen. It can flourish and you can support the healing process. As such, the process is often referred to as low skill, high sensitivity. So the focus is more on your senses. What do you see? What do you feel? What do you sense? And touch and things of that, and taste, and just all of our five senses, incorporating those things and what is that individual experiencing at the time. Each creative arts modality is unique, and the use of each is carefully considered by each expressive arts therapy. For example, journaling might be an appropriate expressive outlet for someone new to therapy. Like myself, I love journaling. I love to write. I'm definitely a writer. And for me, journaling is not hard. It helps me to get what's going on inside of me, outside of me, and on paper. So it's a form of release and ventilation for me. Others, it may be pressure, thinking of sentence order or what to write or how to write it. Does it have to make sense? And it could be, stressful for someone who that's not their strong area, or is just not something that they're interested in doing. So for that individual, they may prefer to draw, or they may prefer to read something that could help them and have a discussion about it, or something of that nature. On the other side of the spectrum, a person who has already established a strong therapeutic relationship with his or her therapist may appreciate the use of movement or drama. So watching a snippet or a YouTube video or something, maybe if it's Christian therapy, like a sermon or something on the healing process, or heartache, or family, or illness, or things of that nature, whatever the situation is, even trauma. And sometimes, like, I know right now Tyler Perry and his plays are extremely popular, and sometimes you can dramatize subjects and topics that are kind of taboo, that people don't necessarily talk about a lot. But if you can find a comical way or a more lighthearted way to kind of delve into the deeper roots of what's going on for that individual, with maybe a substance abuse issue or a childhood trauma that is resurfacing as an adult, or that's causing them not to be the best parent because they weren't parented well, or whatever the situation or circumstance may be. So the expressive arts therapy is definitely an outside of the box type of modality and way of thinking. It says careful use of each modality is determined by the strength, timing, pacing, and readiness of the person in therapy. Different modalities may be used at any point throughout the therapeutic process as needed. Homework may also be issued for a person in therapy to complete between sessions. And that just keeps you focused. It keeps you, depending on what your established goals are, it keeps you oriented on what your goals are. Sometimes individuals, like I said, they may feel pressured or stressed in front of their therapist or whomever is providing services for them. So if they can go home and then kind of decompress, and after work or whatever, take a shower and sit down and read or write or whatever the situation may be, and complete their homework, then it allows them to take home what they're doing. It allows them to process it in an environment where they're comfortable, a setting where they're familiar, which would be their home. Some of the conditions that expressive arts therapy are effective in, these mental health conditions, it's a variety of, it helps you behaviorally, emotionally, and the mental health conditions specifically are attention deficit hyperactivity disorder, developmental disabilities, like developmental disabilities would mean that there is a delay, there may be some form of retardation, and or they just process things at a slower rate than someone or a typically developing child. And I use quotes because what is typical, what is normal for one person is abnormal for another, and vice versa. And who gets to determine or make those rules to say, well, by this age, this is what you should be doing, and if you're not, then you're developing, then your development is challenged. That's a soapbox of mine. I digress. So, eating disorders, and the most common eating disorders is anorexia, nervosa, or bulimia. Anorexia is when you're pretty much starving yourself. When you look in the mirror, you have a distorted view of yourself. So even if you're skin and bones and you're looking like a human skeleton, you see fat somewhere. And because it's distorted and it's honestly not reality, that's not really how you look. That's just how you look to yourself. And there's a psychological component with your mind and things of that nature. Bulimia is that you overeat and then you throw up. So you're messing up the inside of your body because you have stomach acid. So if you're forcing yourself to throw up, you're throwing up some of that acid. And what that acid does is corrodes and it eats away your esophagus, your tongue, anything on the way from your stomach. The acid can adversely affect or even burn a hole in, different things or whatever, because the acid is to remain in your stomach and it's not supposed to come up, to churn away and to break down the chemicals in your stomach. Another mental health diagnosis that expressive arts therapy can be effective with is traumatic brain injury. And some individuals who have experienced traumatic brain injury, their entire personality changes. So it could be an easygoing, very gentle individual who wouldn't hurt a fly. But if they've sustained a brain injury, been hit in the head or shot in the head or had some trauma to their head, cranial area, or their brain, then they might become violent because, your brain is your control center. So if something is disarrayed or misaligned in your brain, it could cause those sort of mood swings. It could cause a lot of things to kind of go awry because it's been interrupted and it's been tampered with and changed or altered. High levels of stress. It helps with high levels of stress. Anytime you're able to do something that you enjoy doing, that's going to increase the dopamine, which is the positive hormones in your body that go to your brain. And you're going to feel satisfied. It's going to feel pleasurable. And it's going to automatically reduce your level of stress. Anxiety. So it helps with anxiety, which is pretty much a fear and sometimes is linked to phobia. Fear of animals, fear of different things, fear of spiders, fear of snakes, fear of whatever. And sometimes it can be fear of the unknown. Like in life, if you've, sometimes when you've experienced trauma or one disruption or dysfunction after another, then life can be unpredictable or seem unsettling for you. So making big decisions, there could be a lot of fear, anxiety. You don't want to make the wrong decision. You don't want to do the wrong thing. You don't want to disappoint certain people or let anybody down, including yourself. So you may experience heightened anxiety and kind of walking on eggshells and just not really knowing what to do or when to do it or how to do it. Depression, it helps with depression. And from what I've learned, depression, the underbelly of depression is anger. And some individuals who've experienced like bullying or teasing or just kind of been targeted for whatever reason, could be their weight, their skin, their height, poor personal hygiene, whatever the situation is, the underbelly, like I said, of depression is anger. You're angry because you've been treated this way. You're angry because somebody is targeting you. You may internalize that anger, and that's why it comes out as depression. So you may blame yourself because you're overweight and they're picking on your weight. And every time you eat, you feel worse about yourself because you think you're going to gain weight, or, you feel like you're perpetuating the cycle of obesity or the cycle of adding to your weight in a negative way. Post-traumatic stress. Now, post traumatic means the trauma has already happened. Post means after. So there's a trauma that happened, and after that trauma, you're still experiencing stress that's directly related to that trauma. So you could be having night sweats, night terrors, nightmares, of something that happened. Say, for example, if you were a victim of a violent crime, somebody attempted to rob you, or there was a rape, or somebody broke into your house, or something of that nature, then you may have nightmares about that occurrence. You may hear things in your sleep, or be unsettled, or be really heightened awareness and in a constant state of alert, because you don't want that trauma to happen again. So you're on alert so that if it does, you can react or respond differently. And that's very stressful. On your body, even, you can be very tense. You can hold tension in your shoulders or your back and neck area. You can have tension related headaches and migraines, and it can not only manifest itself mentally but also physically or physiologically, which also is just physical ailments or physical manifestation of what's going on in your mind. It can begin to manifest in your body. Chronic medical illnesses. So that could be anything. There are so many stress related illnesses, cancer, ulcers, there are lots of illnesses that are exacerbated by stress, like diabetes, hypertension. If you have high blood pressure, and let's say you're going through something that's really stressful, your blood pressure may shoot through the roof. Different things like that. Like, your body has a check and balance system that tells you when something is wrong, something is off balance, something is not right, you're not getting enough sleep, or you're not eating enough, or you're not doing certain things, and you're neglecting your body or neglecting an area of your health, then your body will let you know. And sometimes people's body actually just shuts down because they're not giving it what it needs. And then you find yourself in the hospital for an extended period of time, maybe having to take medications, and then side effects coming from having to take those medications. So there's just a whole there can be a snowball effect when it comes to not getting control or handle on your mental health. And then it can cause areas or rifts or a shift in your physical health. And social challenges. And one social challenge will be anxiety, just fear of being around people. Like I said, if there's been a trauma or something, and it happened out in public, or it happened at daytime or nighttime or whatever, you may automatically become uneasy during those times of the day and things of that nature, in which is directly related to what happened. You could be afraid of people. You could be afraid that someone will hurt you, and it could be like unsubstantiated. Maybe you haven't had a trauma, no one has ever hurt you, but you fear that they will, because maybe you've watched it on television, or somebody that you know and love has experienced a trauma or something of that nature. And it can cause issues. And even it makes me think of our social distancing now, and that presents not a trauma, but that presents a barrier, because with a mask on, you can't smile really, or if you are smiling, no one really knows. So greeting people and eye contact and having to distance yourself from people. If somebody starts coughing or sneezing, or spitting up, or they've got congestion in their throat or something, everybody's looking around and maybe potentially subconsciously thinking, oh, they have COVID, or they have a cold, or they have this, or they're contagious, and things of that nature. But just different social challenges. I think that as a result, as actually post this pandemic, I believe that social interactions will suffer. I believe that a lot of things that we used to do face to face will no longer be that for some people, some by choice and some by force. And I just think that our socialization may suffer, especially teens and younger kids. going through this and having the expectation of being separate from your peers, like even in a classroom setting where you have your own space and you're expected to stay in your space and not interact or touch or be near this person or that person due to the risk of, infecting them infecting you or something of that nature, then socialization is going to be adversely affected long term. So some of the techniques are, features. All right, well, let me just read this. Many definitions of expressive arts therapy mention its use of distinct features such as music. And there's a thing called music therapy, movement, play, psychodrama, sculpture or sculpting, painting, and drawing. If necessary, therapists may choose to combine several techniques in order to provide the most effective treatment for the individual in therapy. So combining those would possibly look like, okay, after you draw me a picture, then the next time we meet, draw me a sculpture of the picture that you drew. Or draw me a sculpture of the opposite. Let's say you drew a picture of someone that's happy. Draw me a sculpture of that same person and them being sad. And things of that nature. And please excuse the noise. My son Philip is attempting to get in here because he hears me talking. And yeah, but he's out. His big brother has him or whatever. But yeah, he obviously wants attention or wants to be in here